Karsten Vrangbæk is professor of political science at the University of Copenhagen. He also has additional appointments in the Department of Political Science and in the new Center for Health Economics. If you could give us a better sense first how long-term care is organized in Denmark.
Right, yeah. Well, I guess the first point would be that long-term care is not really a well-defined term in Denmark in that sense. Sector-wise, it would be healthcare, social care, care for the elderly, etc. So a number of different types of policies. And it also cuts across different administrative levels. So the municipalities taking care of the home-based services, the preventive care.
And the Plejehjem.
Yeah,
the nursing homes.
That as well. And then the regions taking care of the more specialized healthcare services, including the general practitioners in Denmark, which are independent but contracting with the regions.
With the regions.
Yeah. So in that sense, long-term care really falls in between a number of different agents and a number of different institutional settings. So what has been done in Denmark in trying to make the ends meet and deliver seamless services? Well, I guess a major part of the story is the structural reform in 2007, which aimed to create larger municipalities and also larger regions. But in terms of long-term care, it's particularly the idea that larger municipalities, more uniformly sized municipalities also, would be able to develop stronger expertise, better quality and better integrated care across the different sectors that I was talking about before. So care for the elderly, healthcare, social care, etc.
So the question then becomes obviously over the next 7 years, from 2007 to now, the extent to which some of those expectations have been realized and what has been learned.
A lot of work has gone into the municipalities in terms of developing their skills and training and so on. And then what has also happened is that from the national level, we have developed patient pathway programs that are like standardized descriptions of what to do when patients pass through the healthcare system. And these pathway programs really deal with both the municipal care and the secondary care. So it's trying to formalize in a way the different steps and thereby integrating better. So that's one example of an initiative that has been taken.
Yeah. One further question. Are there discussions about further changes that are seen to be necessary in order to provide more seamless services, particularly for the chronically ill? Are there pilots? Are there experimentations? Are there differences between the regions, perhaps, that might serve as opportunities for new notions of how to do this?
Yeah, there are lots of experiments throughout the country, and various ways of organizing the outreach from hospitals, various ways of organizing these local care units. Also another trend is developing sort of joint facilities with co-location between regional staff and municipal staff called health centers, which should sound familiar in a Swedish setting, but they look kind of different in the different regions. So that's an experiment in itself.
It sounds very much like the current structure in Denmark makes it possible for a great deal of experimentation, and that the regions are all trying to develop alternative strategies, as are the municipalities, which means that there will be a real opportunity for those of us on the outside to read the research that will come out as you compare all these experiments and their outcomes.
Yeah.
So thank you very much.
That's true. Yeah, thank you.